Great companies aren't built on average talent. In private equity-backed, high-growth businesses, the right operator changes everything. Onward Headhunting partners with founders, operators, and investors to build elite finance, strategy, and operations teams. From early hires to exit-ready leadership, we deliver the talent that drives outcomes. If you are scaling or transacting, go onward. Visit onwardheadhunting.com or find us on LinkedIn to learn more.
This is Scott Becker with the Becker Business and the Becker Private Equity Podcast. I'm thrilled today to be joined by brilliant leader Amber Walsh. Amber works at the intersection of healthcare and private equity. She's also a remarkable leader and probably the most quintessential professional that I know. Amber's going to talk to us today about some of the thoughts that she's watching coming out of the Veterans Healthcare Administration, the VA. Amber, let me tee it up and have you take it away. What are some of the core thoughts that's top of mind for you about the VA and healthcare?
Yeah, I'm happy to share. It seems appropriate coming right out of the Memorial Day weekend, where we spent a lot of time honoring veteran service. And there's also been a lot of attention going back a couple of years, including with government trimming by DOGE, but also more recently in establishing the 2026 budget and looking towards the 2027 budget. Veterans Affairs have definitely been one of the big discussion points in government dollars. And so I've really been thinking about and querying actually some of my colleagues, how much does the industry understand about the VA? And I'll just start by just sharing some of the basics that I think probably every healthcare industry stakeholder needs to understand. And some of the basics of the organization are that obviously the Department of Veterans Affairs is a cabinet level, but it's split into three divisions. The VHA, Veterans Healthcare Administration, is what administers veterans healthcare, and that comprises about 40% of the roughly $450 billion Veterans Affairs budget. So it's a huge part of what Veterans Affairs does for veterans. There are about 9 million enrolled U.S. veterans with, at any given time, estimated about 6.1 million actively using their healthcare benefits. So the result of this, with the dollars and the magnitude of the number of U.S. current and former servicemen and women who are using these benefits, is that it's produced the largest integrated healthcare system in the country. And yet I think a lot of people don't have an understanding of exactly how it works. And what's really interesting, the extent to which you have so much of the care provided by private, non-VHA owned healthcare providers.
Thank you. And talk for a second about the VA, the quality of healthcare. I know my father still gets care from the VA. It seems to me sort of all over the board in terms of what they do and how they do it. Any thoughts there? And are there opportunities for, I know some of the big EMR companies obviously are deeply vested with the VA, Cerner, of course, Oracle Cerner. I know there's other businesses that go on with the VA. But talk a little bit about what is the situation with the VA? Because it seems like good at some things, not so good at other things. How do people think about that?
Absolutely. I think that's exactly right. So I mentioned, at any given time, 6.1 million veterans actively using their healthcare benefits. They fall into 8 different priority groups depending on their, whether or not their injuries were combat, battle-ridden injuries. There's a need-based component. There's all different ways that veterans fall into the 8 different categories. And then, of course, there are separate, like Campus and TRICARE for active service men and women. But in terms of the care provided, how it's provided, and kind of the feedback from veterans, it's very interesting. So the system has over 1,300 sites of care around the country, and obviously in U.S. territories as well. but 40% of the care is provided by what they call community care. And community care is essentially private, non-VA employed, non-VA owned healthcare providers. And so you mentioned EMR companies, of course, that have different relationships as contractors, but the other type of contractor with the VHA are healthcare providers that essentially enter into the VHA network through contracts. And again, it's about 40% of the care is provided in that way. And so you're talking about anything from on the device side, prosthetics, the exoskeletons, the assistive devices. You have primary care in some areas provided that way because particularly in rural communities, if there's not a VHA hospital nearby, you can have privately contracted primary care, urgent care, and then a lot of the VHA hospitals, possibly all of them, are staffed by Team Health and Envision, which are obviously large private equity-backed emergency medicine and hospitalist companies. And so they've built this network of care that's both a component of employed and owned VHA providers and then these contracted providers to supplement. And then layered over all of that, you have two TPAs, OptumServe and TriWest, which are the two third-party administrators for the claims submitted by the private providers. And so it all comes together. When we talk about an integrated health system, that's what we mean, in that you have the individual providers, both owned and contracted, and then you have the claims that are submitted through the process to ensure that veterans are able to get their care and providers get paid for providing that care.
Thank you. So those must be huge contracts for the Envisions of the world and so forth. Those must be mega contracts for some of these providers and operators that sell into the VA.
Absolutely. And, you know, that was part of some of the controversy in the early days when DOJ was doing its work. Some of the VHA contracts were cut, and then some of the cuts were paused pretty quickly after that when you had some congressional intervention. But yes, those are huge contracts, multi-year contracts typically. And that's one of the other things that industry stakeholders need to understand, of course, is that when you are contracting with the VHA, you're contracting with the federal government. And so you have to go through the federal procurement process. And there are all of these different regulations, of course, not surprisingly, even with the Federal Streamlining Act to make procurement a little bit easier. You still have the federal acquisition regulation. You have the VAAR. You have very specific programs for very specific types of VHA healthcare that you have to contract with. And there's a whole host of requirements, of course, that you have to meet. So for the Team Health and Envision and, Oracle, obviously those are big major contracts that the VHA needs to serve its population, but those are pretty extensive and massive. And then you have individual providers and individual sites too. But it's just a really large system that obviously has such a huge impact on U.S. healthcare.
Certainly, and fascinating you mentioned about the DOJ situation, because no matter what the administration tries to cut, and this is whether it's the Republican or Democratic administration, without any deep thought, you're going to have reflexive negativity to it in an amount of public opinion built up saying, oh, you're taking away care from the veterans, you're taking away care from the veterans, where at least a good thinking bureaucrat or professional would say, how do we do it more efficiently? But it doesn't really matter. You're going to have reflexive action against it. And that's, of course, to be backed up by some of these money sources that profit from it too, I assume.
Yeah, no, that's exactly right. And the other interesting component too about the spending, the VHA spending, is that it used to be more discretionary spending, where Congress would have to debate in appropriations every single year what the entire department was going to get, the entire Department of Veteran Affairs, but specifically also the VHA. Now, after the PACT Act in 2022, it's dominantly now mandatory. It's built right into legislation so that there's roughly only about 30% every year that's discretionary. And so when DOJ is doing its work was really limited to on the VHA side by the fact that you had more mandatory spending than discretionary spending. So that's been another interesting part of the development of the VHA just over time. And a lot of that, of course, is driven by a very, very active advocacy community. Of course, you have more and more aging that they even talk about now. One of the biggest driving forces for the PACT Act in 2022 was actually the 9/11, post 9/11 veterans community that is now aging and needs this health care. So it's been a very interesting development. And I circle back to that point I made at the beginning. I think it's something that anyone who is in the healthcare industry, be it, lawyers like us or private equity investors or, private practicing physicians should understand how it works.
No, absolutely fascinating. And I have to tell you, for all the things out there, when I follow healthcare every single day of my life, I know so little about how the VA and the VHA actually runs, other than periodically seeing news of these huge contracts or controversies, or seeing it anecdotally through my dad's care. That's what I know. So your thoughts on it are so helpful. And know that there's lots of people that do business with the VA in different ways. Obviously, some mega companies do business with the VA and are it's a very important customer to them. It's fascinating.
It is, and it really takes a very specialized legal team and procurement team to put those deals together as well. Like at our firm, it's not just the healthcare lawyers that do those deals. We really lean heavily on our government procurement colleagues, Ned Childs, Todd Stegerda, Pat Rowan. Like, I'm not going to be able to advise a client through the intricacies of negotiating with the VHA without their support, because it's so very rigorous, and the expectations for what you have to fulfill once you have contracted with the VHA, the reporting requirements, obviously the diversity requirements have changed in the past 2 years, kind of famously, but there are a lot of rigorous standards, and it's a whole other level of operations and compliance of which you should be mindful. But with the largest integrated health system in the country, how can you not consider VHA as a viable partner?
No, absolutely fascinating. Thank you so much. Amber, you're literally the best professional I know. Thank you for joining us today on the Vector Business and the Vector Private Equity Podcast and shining some thoughts for us around the idea of the VA and how it works and what's going on with the VA, the VHA, and more. Thank you so much for joining us and speaking with us.
Thank you, Scott.